this video, we are going to cover how to submit a claim to insurance for a patient who had treatment completed. Our patient is Joseph Dirt. This is going to be really similar to the way that we billed Joanne's appointment for her hygiene appointment. So just like we did with Joanne, we're going to double check that Joseph's provider ID in his appointment matches the doctor that he saw. So Joseph was seen by Dr. Richens, and we do have Dr. Richens' ID in the appointment. Again, we're going to go to patient info and open his family file and double check that the provider ID in the family file and the clinic is correct. They are both accurate. We also want to double check that the bill type is right as well. Joseph is under private insurance, so his bill type is correct. Now, just like we did with Joanne, we're going to move on by checking the chart notes and making sure that they match the appointment procedures. So, since Joseph had 2 procedures completed, he had one filling done on tooth number 27 and another filling done on tooth number 20, there's going to be 2 separate chart notes for that. So, we're going to scroll up and ensure that the first chart note matches what the procedures were done. So as you can see, it shows composite restoration, which is correct. It shows that the restoration was done on tooth number 27 for the surfaces MO. When billing for fillings, this is the most important thing to look for. You want to make sure that the surfaces on the notes match what is treatment planned in the appointment. So as you can see, it shows that the tooth number is 27 and the surfaces are MO, and number 27, MI, which is also the same as MO, is in the appointment. Now we're going to go down and make sure that it shows nitrous was done. If this showed nitrous and then didn't have any number next to the minutes, that would mean we did not do nitrous. But this shows that we had nitrous on for 6 minutes, and we have nitrous in the appointment, so this is correct. Now we're going to scroll down to the next chart note, and again, we're going to double check that tooth number and the surfaces. So we're just going to come down to that tooth number, and it says tooth number 20, the surfaces are DO, and the appointment shows 20, DO, and of course the nitrous will stay the same. So again, we're going to come back to this appointment and hit OK, and we're going to hit Alt-F-T on our keyboard. That's going to set complete these procedures. This step is your double check to make sure that these procedure codes are the codes that you want to set complete on the patient's ledger. This looks good, so I'm going to hit set complete. Then we're going to right click on the appointment and come down to ledger. That's going to open up Joseph's ledger, and we can see that these 3 procedure codes are the ones that were done today. All of the ones above are ones that were completed on August 13th. So all we have to do from here is make sure that the provider ID and the clinic are correct on each procedure code. Now we're going to come up to insurance and select today's procedures. That's going to create the claim for us. Now you might notice that the nitrous code is not in the claim. That's because we do not bill nitrous to any insurance. No insurance company covers nitrous for patients, so we charge a low fee of $20. So it looks like everything is correct. We have the 2 filling procedure codes. The billing provider is Richens, rendering provider is Richens, and so is the pay-to provider. Joseph is the subscriber on his insurance, and the release of info and assign of benefits is selected. So now that we have ensured everything is correct, we're going to come up and hit the X, and then click Send a Batch. Now, we're not done with Joseph's ledger. As you can see down here at the bottom, it shows that there is a suspended credit of $20. That $20 is coming from this cash payment. And you might notice that under Provider, there isn't a provider entered in. That's because we haven't applied this payment to the nitrous procedure. So what we're going to do is we're going to double click on the payment. We're going to now apply this to the nitrous. So I'm going to look for charge and look for $20. I have found $20, which is the nitrous code, and I'm going to hit apply remaining and hit OK post. That has now assigned that suspended credit to Dr. Richens, and there's no longer a suspended credit on the ledger. So this claim is now ready to be sent from the batch.